Did you know the human body has over 60,000 miles of blood vessels? If there's a blockage or kinks in any of these vessels, it could lead to major problems in your body. Here to talk about signs, symptoms, and the latest treatment options for vein disease is Dr. Rajiv Agarwal with Modern Heart and Vascular Institute. Good morning.
Good morning, Deborah. How you doing?
Oh, I'm doing well. All right, let me start with there are lots of things that happen with our legs and our bodies that kind of mimic other things. That's why it's so important to get a proper diagnosis. For example, some of the things we talked about with neuropathy earlier can overlap into what's really vein disease.
Yeah, oftentimes people are misdiagnosed, Deborah, with other problems, and then they come and see us. And I wish that they would have come and seen us before because they're put on medications, they've had procedures, and they just don't get better. And it turns out that a lot of it is circulation and not neuropathy or muscle disease or arthritis even.
Yeah.
Some people just assume the wrong diagnosis.
Yeah, and you can diagnose somebody fairly quickly, and there's no pain or anything involved. It's an easy process. You ask a number of questions, and then you take a look inside.
Yeah, and as you see on the picture on the screen, that's on the left side was a healthy vein, on the right side is a damaged vein. And patients have a lot of symptoms. The typical symptoms of vein disease are usually more just fatigue and swelling and cramps and restless legs, varicose veins. I can't tell you how many people that even we see in clinic that have been suffering from these symptoms for so long, and they just put up with it. Like you said, it's the holiday season. People are out there shopping, and if we can get them excellent legs, they'll be able to do a lot more.
Yeah, and you mentioned they put up with it and they're suffering. That's because they're addressing the symptom as opposed to the problem. I can't tell you how many times I've seen people go to the dermatologist because of the open wounds on the legs or the discolored kind of, things on the legs, and they don't realize it's because of what lies beneath. Okay, let's talk about arteries and poor circulation, the symptoms of that.
Yeah, arteries, the key thing to keep in mind is symptoms happen with exertion. So if you're walking and symptoms happen, if you have to rest after a while because your calf muscles bother you or just your hips bother you with walking, that's arterial disease. Whereas with vein disease, symptoms tend to happen more at night or when you're sitting or standing. So that's the key features.
Yeah. And then there are arterial disease, there are risk factors for that versus risk factors for venous disease.
Yeah, arterial disease, like any other artery in the body, it's more susceptible to smoking, high blood pressure, high cholesterol, genetics. And the big thing that we should add nowadays is also COVID is affecting arterial and venous disease. More with venous disease, it's more of lack of motion. People that are sitting or standing for long periods of time. We see a lot of teachers, Deborah, that come in because they're sitting or standing all day long, and they get these achiness, this discomfort in their legs that they put up with for a long time. Uh, that's the distinction between arteries and veins.
All right, it's in your name, Modern Heart and Vascular. There are a lot of people who saw their parents and grandparents go through vein stripping and things like that, and they're like, I'm not going in, I'm not doing that. There's a modern way of taking care of those issues today.
Yes, so previously people would have their legs filleted open, literally, and you'd remove the veins. Problem with that was they would come back. The modern way of doing it is you drive yourself to the office, we fix it, and then you drive yourself right back home. There's no recovery, no downtime. Basically, what you're doing is you're sealing off the vein. So as you see on the video there, you're just putting in a catheter in the vein and either injecting heat or glue to seal off the vein. So now the blood returns through the other good veins, the one or two veins that were causing all the cramps and restless legs at night. If they're not used, those symptoms are gone pretty much forever, Deborah.
Yeah, and we're looking at this picture right here. You can even see cosmetically the difference that's made.
Yes, you see those varicose veins before and after. It's remarkable how beautiful the legs can look. And the symptoms will go away too. I always tell my patients, like, you got to have four good tires to run a car. You got to have two good legs to get around, and people just put up with symptoms for too long.
Yeah, I have a friend who's doing that right now, and she has restless leg syndrome. I can see the veins on her legs. I know that when I send her to you, you're going to say, "Yep, that's what it is." But she's taking medication for her restless leg syndrome. I'm like, why not get to the root of the cause of your restless legs?
Exactly. No pills, no no surgeries. This is a very minor in-office procedure that will make your symptoms go away. I've said before, my mom had symptoms for years before she finally told me she had these symptoms. We fixed her veins, and she's gone 6 to 7 years now with zero symptoms, no cramps, no restless legs for 6 to 7 years now.
All right. As cardiologists, this is part of your practice, but we know that most cardiac issues are with people a little bit more older age, but there are kids that have issues as well, and you all have a pediatric cardiologist on board too.
Yes, ma'am. Dr. Joshua Quinones, he's very highly trained and has been at Texas Children's Hospital. So we're bringing that level of expertise more locally to the communities in Humboldt, Kingwood, Woodlands, Katy, and other areas.
Taking care of the affairs of the heart. Dr. Agarwal, thank you very much.
Yes. Thank you, Deborah. Appreciate it.
To book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com or give them a call at 832-644-8930. Again, that's 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball. And by the way, they have doctors who are fluent in Spanish as well.